Hello, my name is Dave Lassman. I'm the proud owner of Senior Healthcare Team Insurance Agency, where our number one goal is making Medicare as easy as possible to understand, to navigate, and to make certain that you make a fully informed decision with respect to how you get your health insurance coverage through Medicare. The purpose of this video is to give you a broad understanding of all of the most important as well as the most confusing parts of Medicare, to make sure that you get everything that you're entitled to and that you make fully informed decisions based off of accurate and unbiased information. Now, this video is filled with a lot of information, so I recommend that you grab a pen and a piece of paper, take some good notes, write down anything at all that might be confusing or need additional clarification, and you can feel free to pause, rewind, rewatch any portions of the video that might need a little bit more clarification. And you can also feel free to contact me directly to ask questions. My phone number is 866-333-7430. Feel free also to send an email to dave@seniorhealthcareteam.com. And I hope you find this video informative and you enjoy it. And with that, let's dive right in. The name of this video is Understanding Your Medicare Options. There's a great expression or a saying that says you don't know what you don't know. You're going to learn a lot of things that you might not know now throughout this video. But one thing for certain that you know is that you don't want to go broke. And we understand that healthcare and prescriptions and medical costs can be very expensive. So we want to make sure that we put in the best measures to make sure that you cap or cover all of the unexpected costs with respect to your healthcare in the future. In this video, we're going to talk about the parts of Medicare, what they are, what they do, what they cost. We're going to talk about the different gaps in coverage that Medicare does not pay for, and the ways to cover those gaps. And we're also going to talk about the enrollment timeline. Now, unfortunately, there is a lot of misinformation out there about how Medicare works, a lot of misleading advertisements on television, as well as direct mail that you may have received or emails. So hopefully by the end of this video, you'll have a good understanding of the truth about how Medicare works. Part of the confusion is, there's different parts. You hear Part A, Part B, Part C, Part D, and you hear about deadlines and penalties. So we're going to delve into all of that in this video. But first, a little bit about who Senior Healthcare Team is. We are an independent insurance brokerage company. Our goal is helping people to choose the best fit for their needs, their budget, because everybody's a little bit different. So our goal is to help you to cut through the clutter of information so that you can understand easily the choices that you have, so that you can enroll in a plan that fits your needs and budget. Most importantly, so that you can get help and support if and when you need it. We believe in offering what is best for you, not for agents or insurance companies. Our services are 100% free of charge. So please don't hesitate to reach out if you have questions, issues, or problems at all. Let's talk about what Medicare is. Medicare is a federal health insurance program. It was started in 1965 under President Johnson, and it's for people age 65 and older. It's also eligible for certain people under 65 years old that might have certain disabilities. There are currently over 60 million people on Medicare, which amounts to about 10,000 people turning 65 every day. In this video, we're going to talk about different ways people can get coverage through Medicare, but I want to focus on what we call the SMART Medicare model, which consists of Original Medicare, a Medicare Supplement Plan, and a Medicare Part D prescription drug plan. Now, there are two main ways you can get coverage through Medicare. The first is called Original Medicare, sometimes referred to as Traditional Medicare or Straight Medicare. Original Medicare has several different parts which are all bundled together to get you a complete coverage. So you have Part A, which is your hospital insurance or your inpatient insurance. Medicare Part B, which is your medical insurance or your outpatient insurance. Part D, as in drugs, which is your prescription drug coverage, your pharmacy coverage. And then a Medigap, which is also the same thing as a Medicare Supplement. Medigap and Medicare Supplement mean the same thing. So that is one way to get your coverage through Medicare. The other way to get your coverage through Medicare is something called Medicare Advantage, which is also known as Part C. Medicare Advantage combines some of the Part A hospital benefits, some of the outpatient medical benefits, some prescription drug coverage, and it may even have some other services bundled in like dental and vision. But you have to be very careful because Medicare Advantage combines some of the parts of Part A and Part B, but not all of them. And we're going to talk about that in detail a little bit later in this video. Let's start talking about Original Medicare. Some of the benefits of Original Medicare is that you get to keep or choose any doctor, hospital, or provider that you want. This is the most widely accepted insurance plan in the United States. Currently, the Kaiser Family Foundation has reported that 98% of all doctors, hospitals, and medical providers are participating providers with Original Medicare. That's essentially any doctor, hospital, provider that you want to go to. There's no referrals needed for specialists. You have national coverage that travels with you. So it doesn't matter if you live in Florida and you have a family member that lives in Nebraska and you're visiting, your coverage is the same regardless of where you are in the United States. Doesn't matter if it's Alaska, Hawaii, Puerto Rico, New York. Anywhere you travel to, you're covered the same as you would be in your home state. The coverage is guaranteed for life. So you can never lose your coverage for life for any reason other than failing to pay your premium. You can change your plan at any time of the year that you want. You are not locked in at all. And with the right Medicare Supplement Plan, which we'll talk about, you can eliminate some or all of your copays and deductibles. Now, on the flip side, Medicare Advantage, the plans vary from county to county. You don't have any national coverage. You typically will need a referral to see specialists, so you have to go to your primary care doctor and see him or her, and then get a referral to see the specialist that you want to see. There's a lot of network restrictions in these types of plans, prior authorizations needed. One of the biggest differences between Original Medicare and Medicare Advantage is with a Medicare Advantage plan, the insurance company is in charge of approving or denying your procedures, not based on what Medicare approves, but based on their own internal guidelines. You typically have copayments when you go see your primary, even higher copayments when you see any specialist. There are lots of high out-of-pocket costs with these plans. The doctors in Medicare Advantage plans can leave the network at any time that they want, which makes it very risky. These plans can be canceled at any time. They're not guaranteed renewable. So that means if you're in a Medicare Advantage plan, you're only in there for a 1-year term. And at the end of that term, everything can change. The coverage can change. The doctors that you see that may be in network with the plan can change at any time. They also have lock-in periods. You can only change Medicare Advantage plans at a specific time of the year. October 15th through December 7th is the annual enrollment period. And that's when you can make changes to these plans if you don't like them. Otherwise, you are locked in for the majority of the year. I want to talk a little bit about some of the insurance terminology. Co-insurance, when we talk about co-insurance, is when you split your healthcare costs with the insurance company. For example, if your insurance company pays 80% and you're responsible for 20%, that's called co-insurance. A co-payment is a fixed amount that you pay. Typically, when you walk in the door, it might be $25 or $30 for your primary care doctor, maybe $50 or $75 for a specialist. That's known as a co-payment. And then a deductible is a preset amount that you have to come out of your pocket with first before Medicare or other insurance starts to pay. Now, I've got a great little exercise that I like to do with folks if they're in my office or sometimes over the phone. So if you'd like to indulge me and grab a piece of paper, you can work through this with me. So grab a piece of paper, put it up vertically, up and down, and draw a line down the middle of your page, separating the page into two columns. And on the top left-hand column, let's write the words Part A and then hospital stays. Below that, write down a number, $1,556. And then below that, 80%/20%. Now let's go to the other side of the paper on the right column and write Part B and then the words everything else. Below that, please write another dollar amount, $233. And then below that, 80%/20%. And we're going to come back and talk about this. Let's talk about Medicare Part A. What is Medicare Part A? Medicare Part A is your hospital coverage or your inpatient care. So anytime you're formally admitted into the hospital as an inpatient, this would be covered by Medicare Part A. It also covers skilled nursing facility care, hospice, and home health care. Now, let's talk about the $1,556 number I had you write down. What that is your Medicare Part A deductible. This is a per occurrence deductible, so this means that each time you're admitted into the hospital, you're required to pay $1,556 out of your pocket before Medicare pays anything. And this is a per occurrence deductible. So let's say in January you go into the hospital because you had a heart attack, and then in March you're admitted to the hospital because you have COVID. These are two separate occurrences, and you would have to pay two separate deductibles. After the deductible has been paid, Medicare pays 80% of the bill, and you're responsible for 20%. Let's talk about Part B. Medicare Part B is your medical insurance. I had you write down the words everything else because Medicare Part B covers everything other than inpatient care in the hospital. So, your doctor's visits, specialists, things like MRIs, CAT scan, lab work, blood work, even covers things like durable medical equipment. If you have sleep apnea and you need a CPAP machine, that would be covered by Medicare Part B. Wheelchairs, hospital beds, things like diabetes test strips and equipment. All of these services are covered by Medicare Part B. Everything other than inpatient care in the hospital. Medicare Part B also doesn't cover prescription drugs. That's covered by Medicare Part D, and we'll talk about that a little bit later in the video. But anything medical other than being an inpatient in the hospital is covered by your Medicare Part B. Now, going back to our piece of paper, I had you write down $233. Now, what this is your Medicare Part B deductible. This is a little bit different than the Part A deductible, which is per occurrence. With the Medicare Part B deductible, it's an annual deductible. So once you've paid $233 for the year, then for the rest of the calendar year, Medicare will pay 80% of your medical bills, and you pay 20%. So as you can see, there are some gaps in the coverage. Medicare doesn't cover everything. The rest is up to you. Part A and Part B cover 80%. You're responsible for 20%. Now, 20% of an unknown number can be a huge number. So it's important that we put measures into place to cap your exposure to those out-of-pocket expenses. Now, there are different types of Medicare supplement plans. Some are more valuable than others. Some cost more, some cost less. Some cover more gaps, some cover less. It's very important to choose the plan wisely. Let's talk about what are the gaps in coverage. You have your Medicare Part A deductible, $1,556. You have the 20% that you're responsible for in the hospital. You have your Medicare Part B deductible. You have your 20% coverage outside of the hospital that you're responsible for. Now, this is a chart of all of the Medicare supplement plans. And if you take a look at the chart, you can see all the areas that are grayed out are services or benefits that are not covered by these plans. So if we look, on the left, Plan A only covers basic services. It has doesn't cover skilled nursing facility coinsurance. It doesn't cover the Part A deductible. It doesn't cover the Part B deductible. It doesn't cover Part B excess charges or foreign travel emergency. As we go towards the center of the chart, you'll see that there are two plans that cover just about everything, Plan F and Plan G. And the only difference between Plan F and Plan G is the $233 Part B annual deductible. So I want to show you a real-time example of how Supplement Plan G works with Original Medicare. So I want you to write down on your page Plan G and then the words 100% covered. Below that, write maximum out of pocket equals $233. So go ahead and cross out your $1,556 Part A deductible because Plan G pays for that for you. So as long as you have Plan G, you're never going to have to pay that deductible in the hospital. Go ahead and cross out the 80% that Medicare pays in the hospital and the 20% balance that you would normally be responsible for. Go ahead and cross that out because Plan G covers that as well. So if you have a Medicare Supplement Plan G along with your Medicare coverage, anytime you're an inpatient in the hospital, no matter how big the bill is, you're 100% covered and you're not responsible for even one penny. Let's talk about Part B. Go ahead and circle the $233 deductible. You are going to be responsible to pay that. But you can cross out the 80% that Medicare pays for services outside of the hospital, and the 20% balance, which would normally be your responsibility, go ahead and cross that out as well. So you can see, as long as you have Medicare Supplement Plan G along with Original Medicare, your medical bills for the year will never be more than $233. That's your maximum out-of-pocket cost. Let's talk about Medicare Part D, your prescription drug or your pharmacy coverage. These are standalone plans that's not included in the Medicare Supplement Plan. You actually have to choose a prescription drug coverage. These plans cover the cost of outpatient drugs. There are typically 20 to 30 options in any particular zip code. So what we want to do is find the best fit for whatever your current prescription needs are. These are run by Medicare-approved private insurance companies. They help lower your prescription drug costs and help protect you against higher costs in the future. This is very important. You must be enrolled in a Medicare prescription drug coverage, a creditable Medicare prescription drug plan when you're first eligible, or you will be penalized. And that penalty lasts for life. It's called a late enrollment penalty, and you get billed every month for the rest of your life. So even if you're not taking any prescription drugs, you should still enroll in the least expensive prescription drug plan in your zip code to avoid incurring that lifetime penalty. And in most zip codes, the least expensive drug plan is about $6 or $7. So again, the two different ways that you can get coverage from Medicare is either Original Medicare. Again, most people will wisely add a Medicare Supplement or Medigap plan. This is what we call the Smart Medicare model. Or Medicare Part C, which combines some of the services of Part A and Part B and the drug coverage. It's one or the other. It's either Original Medicare or Part C. So let's talk about what Medicare Advantage is. Medicare Advantage is also a little bit confusing because it's not Medicare and it's not necessarily an Advantage. So the name in itself can be a little bit misleading. What Medicare Advantage is an alternative to Original Medicare. It typically has lower monthly premiums, but comes with a lot more restrictions, a lot more risk, and a lot more out-of-pocket expenses when you use it. These plans are managed care plans, which are typically HMO, sometimes PPO. It, again, includes some of the benefits covered under Part A and Part B, but not all of them. And these are run by private insurance companies that determine their own rules and guidelines, which makes it really risky, because what I think of the purpose of insurance is you get it when you're healthy so that, God forbid, anything happens, you know you're covered. But because the insurance companies make the rules and they change them at their leisure, you never know if and when you get sick, if the doctor that you need to see or the facility that you want to go to is going to be accepted. They also include some prescription drug plan, as prescription drug coverage as part of the plan. They may also include extra benefits like dental and vision, sometimes in the plan, sometimes at an extra cost. You've got to be very careful with when you're looking at these plans. Unfortunately, what insurance companies tend to do is entice people to take inferior hospital and medical coverage in exchange for giving them a couple of freebies, like a couple dental cleanings a year, or maybe even a gym membership. But you want to make sure that you're not cutting off your nose to spite your face and giving up excellent hospital and doctor coverage in exchange for, you know, something that you could probably pay $10 or $15 for yourself and not forfeit the excellent hospital and doctor coverage. So again, the options to cover that 20% gap is either original Medicare with a Medicare supplement, and you know there are different types of plans. We'll get into that in a little bit, or Medicare Advantage Part C, where you substitute your original Medicare benefits and you give up your Medicare coverage run by and protected by the federal government in exchange for a plan that's run by private insurance companies that have limited coverage. So again, two main choices, original Medicare and Medicare Advantage. Let's do a kind of a side-by-side of some of the pros and cons. With original Medicare, you have national coverage. Doesn't matter where you are in the United States, you're covered exactly the same as you are in your home town. Medicare Advantage is county specific. With original Medicare, you don't have any networks or restrictions. It's accepted at 98% of all doctors, hospitals, and providers in the country. Medicare Advantage is very restrictive, narrow network of providers. You always have to make sure that your doctor is in the network or would even accept your Advantage plan. Original Medicare, there's never any referrals needed to see specialists. Typically with Medicare Advantage, they have strict rules to get coverage. You need referrals to see specialists. There are pre-authorizations. Original Medicare, you have the freedom to choose your treatment and to choose your providers. Medicare Advantage, the insurance company dictates what tests and procedures are approved for you. The original Medicare plans are standardized. That means they're exactly the same for everybody in the country. It doesn't matter where you live or your age. Medicare Advantage, the contracts and terms are negotiated and renegotiated yearly. Original Medicare plans are guaranteed renewable for life. So if you are enrolled and approved, as long as you pay your premiums every month, they can never drop you for life. So no matter what happens health-wise, you can never be dropped for any reason other than failing to pay your premium. With Medicare Advantage, it's not guaranteed at all. In fact, the terms are only 1 year, which makes original Medicare a lot more stable and predictable. The costs are capped. With Medicare Advantage, you're required to pay co-payments, co-insurance. You've got a lot more out-of-pocket costs. Original Medicare gives you medical and financial security. As of the Kaiser Family Foundation report, the average out-of-pocket costs on these Medicare Advantage plans are $9,200 per year. That's $9,200 a year out-of-pocket cost for the quote-unquote free Medicare Advantage plans. So one of the misleading and confusing parts of Medicare Advantage and how they're presented to folks is that they are quote-unquote free or they don't cost anything. Like everything in life, you always get what you pay for and you never get something for nothing. And the reason that these plans cost so little or don't cost anything is because when you use them, you have huge out-of-pocket costs, and you still have lots of restrictions and limitations as to what's covered. Another benefit to original Medicare is that there is no lock-in period. You can change your plan at any time of the year that you want. Contrarily, with Medicare Advantage, you're locked in. You can only change your plans during specific times of the year. The annual enrollment period when you can change your plan is between October 15th and December 7th. So if, in April, you realize that you don't like the Medicare Advantage plan and you want to try to go back to original Medicare or get a Medicare supplement, you're going to have to wait until at least October 15th to submit an application. You're going to have to be underwritten, so they're going to look at your health and they're going to look at your prescriptions and decide whether or not they want to accept you into that plan, and the coverage doesn't begin until January. So again, makes it very risky. Medicare supplement plans are standardized. What does this mean? That means that the plans are standardized by the federal government, so that means that it doesn't matter who the insurance company is. It doesn't matter where you live in the country. The plans are the plan with the same letter is the exact same company. For example, a Plan G with one insurance company is exactly the same as a Plan G with any other insurance company anywhere in the country. The benefits are all exactly the same. Now, the premiums that the insurance company can charge you vary dramatically from insurance carrier to insurance carrier. So it's really important that you're working with an independent broker or agent that can bring the entire market to you. For example, if you want to look at Plan G, well, we want to look at a couple of things when we recommend which company to choose for Plan G. It's important to look at the current rate that the insurance company charges. You want to go with, one of the lowest, the companies that charges one of the lowest premiums for that plan that you want. You also want to look at the strength, the financial strength of the insurance company. We typically don't work with, or we don't recommend any insurance companies that have less than an A credit rating. But probably the most important feature to look at when I'm recommending an insurance company to somebody is the history of rate increases. So some insurance companies in a particular market may raise their premiums every single year like clockwork. And there may be other carriers that don't raise their premiums frequently. I don't have a crystal ball. And anybody that tells you they know when an insurance company is going to raise their rates is not being truthful. But for me, the best indicator of what a given insurance company is likely to do with their rates in the future is looking at what they've done in the recent past. If an insurance company has only had 2 rate increases over the last 5 or 6 years, that's a pretty good indicator that that's what's likely to happen in the future. If you look back and you see that carrier has been raising rates every single year, that's likely what's going to happen in the future. So we want to carefully evaluate and look at these different factors when choosing which carrier to go with for your Medicare Supplement Plan. Let's talk about some of the costs. Medicare Part A is your hospital coverage. Most people will get this premium free, meaning you won't have to pay anything for it. As long as you have worked for 40 quarters throughout your lifetime and paid into Social Security, 40 quarters amounts to 10 years over your lifetime, you're going to get Medicare Part A for nothing. Medicare Part B, your doctor coverage, the standard premium in 2022 is $170.10. You must be enrolled into Medicare Part B, whether you choose to go with original Medicare and get a Medicare supplement, or whether you go with a Medicare Advantage plan. Okay? The Medigap plans, they vary by age, gender, zip code, and tobacco use. So feel free to contact your agent or contact me if you have any questions about what are the particular rates in your town. We're happy to provide that for you. Part D, prescription drug coverage, it's as low as $7.70 in most zip codes. So again, looking at our 2022 standardized Medicare Supplement Plan chart, Plan F and Plan G are the most comprehensive of all of the plans. The only difference between Plan F and Plan G is that $233 deductible. If you choose Plan F, the plan pays that for you. So you're 100% covered on any hospital or doctor's bills from day one. If you choose Plan G, you're responsible to pay that deductible. Once that deductible has been paid, F and G are exactly the same. You're 100% covered for the rest of the year. Now, if you were eligible for Medicare, if you were first eligible for Medicare before January 1st of 2020, you can choose the F plan or choose the G plan or any other plan that you want. For Medicare enrollees that were eligible for Medicare after January 1st, 2020, the F plan is no longer available for you. So the best, most comprehensive plan for those folks, which will probably be most of the folks watching this video, is going to be Plan G. Now, don't worry if you're not eligible for Plan G. In almost every zip code of the country, except for a couple of little pockets, South Florida being one of them, the G plan is a better value than the F plan. So even if you're eligible for the F plan, you probably still want to choose Plan G. And the reason is, in most parts of the country, the difference in cost, the difference in annual cost between Plan F and Plan G is considerably more than the $233 deductible that you're supposed to pay out of pocket when you choose the G plan. So it's just a better value where you'll save more money to pay that deductible directly as opposed to just paying much higher monthly premiums to account for not having to pay the deductible.
Now I'd like to show you how, as an independent, unbiased insurance broker, we can compare all of the different rates for all of the different insurance carriers offering a specific plan type in a particular zip code. This is a quote engine that we use that gives us real-time data of every single insurance carrier in the market and the different premiums that they charge for the different Medicare supplement plans. Let's go ahead and put in a particular zip code, 60035, Highland Park, Illinois. Let's put in an effective date of 2/1, February 1st. Let's compare the rate of a 65-year-old non-tobacco using female, and we're going to look at the rate for Plan F. Now this will bring up all of the different carriers offering that Plan F in Highland Park, Illinois, and it's going to sort it by the least expensive all the way down to the most expensive. So here we have all of the different Plan F plans by carrier sorted from the least expensive all the way down to the most expensive. And if we look here, we've got 1, 2, 3, 4, that's got to be about 10, 20, over 30 different insurance carriers, all offering the exact same standardized Plan F. The least expensive option is with Aetna. The rate is $130.93 per month. I'm going to write this down. And as we start going down the list, you can see Manhattan Life, $134. Let's keep going down. You have $144. Here's Humana, $153. Blue Cross Blue Shield, $157. Mutual of Omaha, $162. Transamerica, $183. Cigna, $200. All the way down. AARP, United Healthcare, $372 a month. There's a difference of $130 for the least expensive Plan F, all the way down to $372 a month for the most expensive Plan F. Again, these are all exactly the same coverage. So there's a difference of $242 a month that one carrier charges versus another carrier's plan for the exact same coverage. I don't know why anybody would want to pay over $300 a month for the exact same coverage you could get for $130. This is why it's so important to shop for the best rates in your market, because you can pay more, but you don't get anything more for paying more. Now I want to show you a real-world comparison of why the G plan is a better value in almost every zip code than the F plan. So here we see Aetna has the least expensive plan F for $130 a month. Let's search for plan G. So we're going to put plan G into the quote engine. And we can see that the least expensive plan G carrier is $109.57. So remember, our least expensive plan G was $130.93. And the least expensive plan G is $109.57. So there's a difference of $21.40 between the best value plan F and the best value plan G. If we take that monthly cost difference of $21.40, we multiply it by 12, so we get the cost per year. It's $256.30 more for plan F than for plan G. And if we remember, the only difference between plan F and plan G is that with plan G, you're going to pay the $203 Medicare Part B deductible yourself. With plan F, they're going to pay it for you. So if we take the $256, the difference between F and G, and we subtract out the $203 deductible that you're going to pay directly, we'll see that there's a savings of $53.30 by choosing plan G and paying the deductible yourself versus plan F. The other nice thing to think about is that you only pay that $203 deductible if you use it. While with plan F, it's built into your premiums regardless of if you use it or not. And it's almost like they're charging you a $53 convenience fee to pay that deductible for you, and you can do it yourself. And that's why the plan G is a better value than the plan F.
Now let's talk about the enrollment period. You can enroll in a Medicare Supplement Plan up to 6 months before the month you turn 65. And I encourage you to start looking at your plans that early, if not a little bit earlier, because the earlier we can start working and figuring out what's best for your needs and budget, the more money we can help you save, and that's our number one goal. When you're turning 65 in your open enrollment period, you have the right to buy any plan with guaranteed approval. What that means is there's no medical underwriting during this window. The window of your open enrollment period lasts until 3 months after the month you turn 65. And in that period of time, you can choose any coverage that is available, and the insurance company cannot look at your medical history. They can't look at your prescription history. The only thing they can ask you is, what is your height and weight, and are you a tobacco user? And you have a guaranteed approval, and that coverage is guaranteed for life. If you're working with a good agent or somebody like Senior Healthcare Team, what we can do for you is help you to compare and select a Medicare Supplement Plan by shopping the market. We'll also help you compare the Medicare Supplement Plan versus, you may have employer coverage that you may want to stick with, or a retirement plan. We're going to put those side by side. We're going to compare all the costs and all the benefits, and you'll choose which plan saves you the most money and gives you the best benefits. I can't help you decide what's best for you, but I can give you all the information that you need to make that informed decision. We provide unbiased, personalized information, helping with the process of helping you to determine which company to choose from. Again, our loyalty is to our clients. We don't have any loyalty or bias towards any insurance company. We work with them all. So to sum it up, I hope you found this video educational and informative. Hopefully it clarified some confusion that you may have had. Our goal is to help you to stay informed, to stay healthy. Make sure that you regularly work with your agent to review your plan on a regular basis. Make sure that you always have the best, most affordable plan for your zip code. Again, I'm David Lastman from the Senior Healthcare Team. Our goal is to make Medicare easy for you. Please don't hesitate to reach out to me. I'm going to post my email address on the bottom and our phone number. Feel free to call the office, ask for me with any questions that you have at any time. I hope you have a great day and look forward to speaking with you.